Well, healthcare was certainly a hot topic on today's campaign trail, so we have three candidates here to discuss their party's priorities. Jenny Kwan is a British Columbia NDP candidate. She joins me from Vancouver. Hello.
Hi there.
Dr. Doug Eyolfson is a Manitoba Liberal candidate. He is in Winnipeg. Hello to you.
Hello.
And Eric Duncan is an Ontario Conservative candidate. He joins me from Cornwall, Ontario. And hello to you as well.
Good to be here. Hello.
So let's talk with Dr. Eyolfson first. I am curious about how you describe what was promised today. It's lots of billions. There's lots of billions flying around. So $3 billion to help provinces hire at least 7,500 doctors, and then another few billion, I guess, to primarily deal with things like waiting lists, among other things. It's not all that different from a promise that the party made in 2019. So what confidence should Canadians have that a 2019 promise will be a fulfilled 2021 promise?
I think Canadians should be very confident. That was made in good faith, and of course that many initiatives were slowed down drastically with the pandemic. A lot of resources had to be diverted to this, but the commitment to increasing access to Canadians for health care and primary care still stands.
Okay, the big promise coming from the Conservatives, Eric Duncan, is the boosting of the Canada Health transfer to at least 6% from its current rate. It has a long history, as we know, and I think people go down that rabbit hole of the history of the escalator. But let's just talk about the top line promise, which is the $60 billion over the next decade. Will that funding be unconditional, or will there be strings attached to it?
Well, thanks again for having us on. And yes, we are looking at drastically increasing transfers to the provinces to increase healthcare spending. And there will not be strings attached in the sense that we want to be partners with the provinces. Each province knows when it comes to, for example, long-term care, mental health, these subjects and the flaws in those systems have come up numerous times during the pandemic. So we've said we're going to partner. We trust the provinces, but we're going to provide that minimum 6% increase every single year. We're in the middle of an election. We have a full platform on what we're going to do. Liberals, like we just heard from Doug's answer, is that 2 years ago, they promised something. They didn't deliver it. Now they're saying, oh, well, trust us again. We've been very clear from day two of our full platform that we're going to provide increased funding transfers. The provinces know they have a partner and they know what they can expect. Stable, predictable, drastically increased funding to help our healthcare system.
Okay, and let me go immediately to Jenny Kwan now. I want to talk about the Ndp promise because it's different in that, again, the Ndp is talking about coming up with a roadmap to bring, for example, universal dental care to the public system. What can you tell? A lot of billions attached to what the Conservatives and the Liberals are talking about. How many billions attached to your promise?
Well, let me first go back and respond to the fact that the Conservatives under the Harper administration, they actually unilaterally cut the escalator costs, cut healthcare transfers to the provinces. And at the time, Mr. Trudeau, in opposition, spoke out against it. And so then when he became prime minister, he did nothing to reverse the cuts. The provinces are struggling, and the federal government actually, frankly, have not shown leadership. So now, during an election, both the Conservatives and Liberals are saying, oh, yes, we're promising that we will deliver healthcare. The truth of the matter is the Harper government cut healthcare transfers to the provinces. The Liberals said that they were against that, and then, of course, did nothing about it after they became
I would say, though, there was a formula set out that had an escalator at 6% that went back to 3 as a floor, but still contingent upon GDP. And you're right, Trudeau kept it there. He didn't do anything about it. But I would like to talk about what we're talking about today on the campaign trail, which is why I asked you specifically about the big promise coming from the NDP on dental care. So can you just tell me what that is and what it could cost?
Well, absolutely. On the issue around the dental care, we've actually costed it with the Parliamentary Budget Officer. And what our program is that we would provide dental care for people making $90,000 or less as the start to begin that process. We know that many Canadians cannot access dental care, particularly seniors, for example. Many of them, their teeth are getting worn out actually with age, and they're not able to chew the food. Actually, some seniors have told me that they have to blend up their food in order to get sustenance. And that's just something really wrong with that. With our promise, the Parliamentary Budget Officer has costed it out and says that it is manageable and it is actually doable. Equally important, of course, is Pharmacare. Just today, I talked to a couple of constituents who suffer a stroke, and they have huge costs to their Pharmacare, and they are not covered for their Pharmacare either. And so, people are really struggling. In the House of Commons, the NDP actually moved a motion to say that we need to begin this work, that we need to bring in universal Pharmacare and begin the process of providing dental care. Sadly, the Liberals and the Conservatives both voted against it. And finally, when we talk about, reducing the escalator cost, cutting it from 6% to 3% is a lot of money. And they
promise more. And I'm just going to stop you there, Jenny Kwan, because I do want to talk to the other people on this panel, and I think we got your point. You made it. So let's just move on. I want to go back to our candidates. First of all, Doug Eyolfson, who's the Liberal candidate in Manitoba. And I just want to talk to you again about, a lot of money was promised today. There was also a lot of discussion, and I will talk with Eric Duncan about this as well, about the role that private healthcare plays in a universal and public system. A lot of points always get made around this during campaigns, and we know that there's been a lot of discussion about what happened with Twitter and that piece of tape. But I have to say that I think we all acknowledge there is a role for private healthcare. What is the Liberals' view on that? What role does private healthcare have in our universal, publicly funded healthcare system?
If there may be a limited role for certain types of private care. However, what is certainly not desirable is a two-tier system where you have private providers that will allow people who have more money, more privilege, can afford better insurance to jump the queue and receive a different standard of care. That is not a universal healthcare system. Everyone may have access, but you're going to have different levels of access. And if you have different people accessing different levels of care based on their income, that's not truly a universal system.
Yeah, I have to say, Eric Duncan, when I was listening to Aaron O'Toole today, and he was asked repeatedly about his view about private health care, and I don't think I heard the word private escape his lips once, even when it was sort of asked, with all these billions you're promising, will there be any strings attached, and to, not allow a lot of those billions be used to facilitate more private care? What is the Conservative view on the role of private health care within a universal, publicly funded system?
Well, I'm glad you said universally public system. That's what we support. That's part of our Canadian identity. It's part of our backbone. It is a strength of what it makes us as Canadians. When it comes to healthcare, the delivery, the provinces, and each province knows what's best and how to do it. I think what Canadians need to know at the end of the day, the most important thing, we are going to increase transfers that are giving to the provinces. We're going to increase the amount of money. I just want to go back and clarify with Jenny as well. Every single year under Conservative governments, the amount of healthcare spending transferred to the provinces went up. Every single year. There was no cuts. More money than the year before every single year. We've gone and said we're going to give 6% to go back. So again, we have a universal, publicly accessible, single-tier healthcare system. It's the core of our Canadian identity. And again, Kathleen, I just want to say this about that doctored video from Chrystia Freeland. It was nothing short of pathetic that they edited that video. And here again, they're doubling down. They're trying to mislead and say about a two-tier system and do all this fear-mongering. They got caught.
Can I just say Twitter, a lot of people, like I take your point. I know what Twitter flagged it, but let's not forget, Lots of people edit videos. A lot of parties edit videos.
Doesn't make it okay.
And obviously,
it doesn't make it okay.
The monetary policy clip of the Prime Minister was also shared on social media, edited without his full comment there. So it's not to say two wrongs make a right. My point being that this is how it happens in campaigns often. The difference this time is that Twitter flagged it.
Well, and again, they deliberately cut out the parts that reference the universal public healthcare system.
But they also had a link to the full video. They did include a link to the full video in the thread.
Kathleen, after they were caught, after they admitted and Twitter put that flag up, they knew it, and they're still trying to fearmonger here today. And again, I'll just say the narrative of the campaign, Kathleen. You see our full Conservative plan available on day 2. We are looking at Canadians in the eyes with Canada's recovery plan and giving a detailed, internally balanced at this point and costed plan. We're working with the parliamentary budget officer. The theme of this campaign, I think it speaks to ethics and integrity, which the Liberals have problems with. But even more to that is the part that is amazing. We are over a week into this campaign, and the segment earlier in the introductory said the Liberals are going to have a platform in a couple of weeks. Election day is in a couple of weeks. The people who've been most caught off guard by this election is the Liberals. They're flailing all over the place. Okay. They're desperate. Okay. And tell me, we have a crystal clear plan. The contrast, I'm happy to put it up any day of the week versus the Liberals going all over the map.
Okay, I think they say them's fighting words. So, but we've got a few more weeks of a campaign to see how that battle goes. I will leave it there just because we are out of time. I want to thank you all. That is Dr. Doug Eyolfson, as well as Eric Duncan, and Jenny Kwan. Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.